Hello, hope you are doing well. You are with Professor Weber, head of European American Laser Clinic. Uh, One of the most common questions from our patient is what is your method about treatment of diabetes type 1? Could you explain for us?
Thank you very much for nice introduction, for inviting me. Well, diabetes all over the world is a growing burden. Both types, type 1 as well as type 2. Let me first put down too high expectations. We are mainly afraid, you are a diabetologist yourself, we are mainly afraid about the long-lasting effects of diabetes. We are afraid about polyneuropathies, we are afraid about wound healing disorders, we are afraid about insulin resistance, and there, first of all, we can do a tremendous job. We know that in all diabetes patients we have impaired metabolism. Most diabetologists are only focused on the insulin, but it's much more, in my opinion, to diabetology. We always would suggest to look at certain trace elements like chromium and zinc, well described in the literature. We try to prevent the progression to polyneuropathies, to micro and macroangiopathy by different methods. This includes mitochondrial medicine, but this includes as well the use of the light, the use of the laser. This may be applied transdermally to counteract polyneuropathies, and this is quite often that we use intravenous light irradiation. There are good studies already published in as early as 1991 by Russian scientists showing that 10 times intravenous irradiation at that time with a low power laser device could significantly reduce the glycosylation of the hemoglobin and other lipoproteins. So we have a very effective method to prevent effects of hypoglycemia. And it's not only this, many of the diabetes patients, you know as well, suffer from hypercholesteremia, hypertriglyceridemia, and this we can counteract with intravenous irradiation as well. In the type 1 diabetes patients, you often see they use a single place only for the injection. There it's lipid hypertrophy. By different methods, including the use of transdermal irradiation, for example, with this high power class 3B laser, we can get penetration of photons deep into the tissue and enhance local healing processes. And by this, we can reduce the risk of insulin resistance. And yes, to come to, I think, the main idea behind your question, and many patients all over the world that make contact with centers who perform similar things. Sometimes, if you are in early stage of the diabetes, when the autoimmune process is just in the beginning, you may have good results with stem cell therapy. Some big American centers publish good results, and we start out with this method as well. We have to be honest, and this is one of the principles of the European American Laser Clinic as well as all European laser clinics. We always try to be as honest to the patient as possible. So we wouldn't put too high expectations. This is experimental, some terrific, some outstanding results, and in the selected group of patients we would recommend if we would perform such a treatment.
How many years we have opportunity for doing this treatment?
I would say, of course, the best chance is if you do it in the honeymoon period, shortly after limited reports show that even after a year they get at least a temporary remission of the disease.
For how many years? About?
Well, we have to be honest, we don't have the experience that we can tell. We could reduce the insulin intake, or we could regain normal function for a time of 10 years period. The time period we overview is up to 2 years, and there we get in some patients very good, very promising results. And by the use of the laser, once again, we, with the help of interventional radiologists, we bring the stem cells into the right place. But afterwards, we would use intravenous light irradiation to enhance the survival of the stem cells. We know very well the stem cells demand on healthy mitochondria, and photobiomodulation, photomedicine is mitochondrial medicine at its best, is using the targeted wavelengths of light to stimulate the mitochondria of the stem cells and to enhance their survival, and by this get better chances of regaining health for the patients.
And usually, how many sessions we need to do it?
I would suggest to plan for a minimum of 4 sessions.
4 sessions. Up to how many sessions?
I don't think it would make much sense to do more than 8 to 10 sessions. Yeah.
And could we use this plan for adults with type 1 diabetes?
Once again, yeah, there are in adults some good, small, quite a few good case reports and a limited number of small surveys, small studies. But don't put the expectations too high.
Oh, okay.
You can be sure, once again, we would give the patient the, as good as we can, precise perspective, whether they would be to the lucky group or whether it's only a small hope.
Okay, that's great. Thank you very much for having us. Do you have any comment?
Well, thank you very much for inviting me. Thank you very much for sharing these ideas. It's an ongoing process, and I'm convinced month by month, year by year, we get more experience and our results will get better. We are in exchange with huge universities. We are in scientific exchange, so I'm sure if we would repeat this talk in 2 years, I could give you much more precise answers and much more own clinical experience.
Thank you very much. To having contact with us.
Thank you very much as well.